I'm here today to talk about healthcare burnout in Canada. This has always been an issue for many years, speaking from personal experience. But the last 2 years have been experiencing a pandemic with COVID-19 outbreak worldwide. Burnout was common before COVID-19 and is now rampant. Severe emotional exhaustion was often in the range of 20 to 40% prior to the pandemic. Rates were higher in intensive care units and emergency medicine. Compare that Canadian surveys later in the pandemic reporting rates of 62, 63, and even 72%. Healthcare burnout has risen so high that the government had to call on the military for emergency relief more than once in some towns and cities. COVID-19 vaccines were produced and made mandatory for healthcare professionals. Because of this, Ontario just alone has lost 40% of nurses, doctors, and other healthcare professionals. The Bureau of Labor Statistics recently stated that employment in the healthcare is down 524,000 workers since February 2020. In addition to risking their own health, many healthcare professionals have been working longer hours and are often unstaffed if colleagues are in quarantine or ill. Many maintain their full-time job while their children were unable to attend school. They must also manage uncertainty as policy changes and virus mutates while providing care to critically ill and vulnerable individuals who choose not to be vaccinated. We're in such a crisis situation that healthcare professionals working in hospitals and care clinics are being forced to work while infected with COVID themselves. It's being called work isolation. Staff can work with their coworkers and with patients, clients, etc., but when on breaks, they have to go to separate areas. The Ministry of Mental Health and Addictions said the pandemic has had a devastating impact on the workforce in many industries, and particularly for frontline workers. Multiple studies show healthcare workers are exhibiting signs of post-traumatic stress disorder, stress, anxiety, and depression as a result of their work. The ministry also said that it's working with partners like the Canadian Mental Health Association, Safe Care BC, unions, employer groups to expand the number of supports available to such workers. The federal government and the Department of Health and Human Services is now committing $100 million to help solve the problem. This investment is critical to ensuring public health officials can continue supporting specific needs across the communities. The funds, which are now open for applications until April 8, 2022, are eligible for programs to support, recruit, and retain primary care professionals. The department hopes that being able to retain healthcare workers in unserved areas will help improve health. In rural areas in particular, the struggle to hire and retain doctors existed long before the pandemic, but the problem has worsened in the past years with COVID-19. I feel that we are nowhere near the end of this pandemic, and it will only get worse before it gets better. We all have to stay strong, safe, and remember that there is assistance available. If you need to talk, check with your local areas for phone and in-person assistance programs. Don't wait.